All right, well, why don't we kick this off? Again, thank you everybody for joining this virtual event. It's new to us, new to you, so we'll see how this works. So basically, this is the Motion's Fall Mini Summit. I'm Diane Valade. I work for Henry Ford Health System, and I'm one of the co-chairs of the Motion Coalition. I'm very proud to say that Henry Ford Health System is very actively involved in working to improve community health, and very happy to be part of this coalition, which we've been a part of for many, many years. Our other co-chair is Dr. Bill Dietz, who will be presenting to us shortly. I do want to mention that as a result of strategic planning that we conducted a few years ago, the motion purposely shifted from being a networking coalition focused on sharing and learning what members, community organizations and others are doing to improve physical activity in nutrition in Detroit and Wayne County, to an organization seeking stronger collaboration actually with other like-minded organizations, really working together to influence and advocate for federal, state, and local policies that will lead to healthy living. So as you listen to the presentations today, please think about how we can translate the challenges and recommendations that we hear into policy solutions. With that, I want to get started, but I do also want to remind you to make sure that your cell phones and microphones are muted during the presentations, except if you're going to be presenting, then you turn yourself on. If you have any questions or comments during this conversation, please type them into the chat function. We do hope to have time for a virtual Q&A after each presentation, but we will take a look at those questions after the meeting. Slide 3. Please allow me to introduce Loretta Bush, President and CEO for Authority Health. Loretta.
Hi, I'm Loretta Bush, President and CEO for Authority Health. And it's my pleasure to welcome you to the annual meeting of the Motion Coalition. Throughout the year, the coalition has worked continuously to promote policies and practices that positively impact childhood obesity. As the proud sponsor of the Motion Coalition, Authority Health strongly supports efforts that promote active living and healthy eating among young people, as well as throughout the life cycle. I'd like to thank our co-chairs, Dr. Bill Dietz and Diane Valade, for their leadership and the commitment that they have to serving the community. I'd also like to acknowledge our very own Dr. Carolyn Custer. She provides staff support to the coalition, but she also has a strong belief that we truly can make a difference. As a coalition, we offer the community an excellent example of collective impact at work and in action. The Motion Coalition began with an inspiration from the former First Lady, Michelle Obama. It was her Less Move campaign that inspired us and continues to inspire us in our efforts to create a healthier community in Wayne County. I wish you the very best today for a wonderful summit, and I look forward to the discussion and the recommendations that will emerge. But most of all, I look forward to working with you in the days and the years ahead. Stay safe. And now I'd like to welcome Governor Gretchen Whitmer as she brings greetings.
Hi everyone, this is Governor Gretchen Whitmer. I wanted to take a moment to welcome you to the tri-annual Motion Coalition, the mini summit. The COVID-19 pandemic has reduced structured physical education options and informal activity. This problem is compounded by low-income situations, parents who must cope with the additional stress of supervising their kids with their virtual homework in the confines of their households. But with nearly 1 in 3 kids in Michigan overweight or obese, we're concerned that our kids will have more chronic diseases and premature deaths from poor eating habits and lack of physical activity than from exposure to tobacco, alcohol, and drugs. Our state's approach to these problems during the COVID crisis will depend on collaboration with networks such as the Motion Coalition. Your support of our administration's public health goals is critical. I look forward to continuing to work with the Motion Coalition to continue our efforts in combating childhood obesity, promote healthy, active lifestyles. Thank you all for your work and best wishes for your summit.
Our first guest speaker is Dr. William Dietz, our motion co-chair. We will send out you more detailed bios at the end of the meeting along with all the slides. But I do want to mention that Dr. Dietz is chair of the Sumner M. Redstone Global Center for Prevention and Wellness at Milken Institute School of Public Health at George Washington University, and the director of the Stop Obesity Alliance, also at George Washington University. So with that, I'm going to let Dr. Dietz do his presentation. Thank you, Dr. Dietz, in advance.
Thanks, Diane. And if I could have the next slide, please. Next. Great, thanks. So today I'm going to talk about the global syndemic of COVID-19, obesity, and food insecurity. And to begin with, syndemic comes from the combination of two words, synergy and epidemic. So a syndemic is an interaction of these pandemics or epidemics, all of which occur in the same time and place and have a negative impact on each other. So COVID-19 is associated, people with obesity have an adverse course with COVID-19. COVID-19 is causing food insecurity. And I've added climate change because we're overriding, we have to think long-term about the effects of all of these things. Next slide, please. So here's how these interactions occur. So the effects of COVID-19 infections not only have this adverse effect on obesity, but the inactivity caused by the lockdown increases the likelihood of obesity. And the reliance on ultra-processed foods, that is foods which are packaged, have a long shelf life, has increased, and that contributes to obesity. The same kinds of factors or similar factors affect food insecurity. So we know that food insecurity is increased in Black, Indigenous populations and people of color. That food insecurity is increased because people have lost jobs, they have less money. And as a result, they are more reliant on food banks and federal feeding programs. So this is a syndemic. This COVID-19 has this adverse effect on obesity and food insecurity. Interestingly enough, it has, so far at least, has had a positive effect on climate change because of the reduction in car use associated with the lockdown. Next slide, please. So these effects are the consequences of an agricultural system. We know that COVID-19 has an adverse impact on the agricultural workforce. So that, for example, in many of the packing plants, up to 85% of workers there are people of color who live in poor working conditions. They have poor nutrition. They have low wages. They lack protective equipment. All of these factors increase the likelihood that they're going to be affected by COVID-19 and have these other consequences of obesity and food insecurity. Similarly, they have an impact on the agricultural system. So that, for example, we know that the system has been disrupted along the supply chain by workers in the fields having an increased risk and frequency of COVID-19 infections. We know that processing has decreased, which has increased the costs of food and decreased availability of those foods. And finally, decreased access. I should have mentioned earlier that food insecurity by itself may contribute to obesity. It certainly looks apparent in adults, and although the kids have not yet been systematically studied, it looks like maybe the same effects exist in that group. Now, the problem doesn't start with the agricultural system. Next slide, please. It really begins with these deeper drivers that sustain this agricultural system and the poor living conditions and low wages of the workforce. That's a consequence of our immigration policy. It's an indication and a reflection of structural racism, which keeps people in these low income positions and limits the food supply. And among the most important is the priority of profit over health by the groups that are responsible for the agricultural system, from farm to fork. Now, thinking about this as a syndemic of these three factors, COVID-19, obesity, and food insecurity, leads us to what I call triple duty solutions, and those are shown in the next slide. So one of the most essential steps that we can take is to stabilize the food supply chain. And that means addressing the structural racism inherent in that food chain. So that, for example, unionization to improve worker conditions, housing, medical coverage, wages, and personal protective equipment would be a step in the right direction. We need to build and strengthen local, regional, and resilient and sustainable plant-based food systems, shifting from a meat-based diet, which again will have an impact on reducing climate change. Part of this means realigning the subsidies that keep the existing foods cheap and make fruits and vegetables more expensive, and reducing reliance on ultra-processed foods, the production of which is associated with environmental degradation. These are triple duty solutions that will improve the health of the food supply chain workforce and decrease COVID-19 infections. With respect to obesity, healthier diets for obesity and diabetes will reduce the impact of these factors, these diseases, on susceptibility to COVID-19 and reduce mortality. As Jim Salus is likely to say later today, increased physical activity improves immune function and thereby improves resistance to COVID-19 infections. And finally, the reduction to exposure of SARS-CoV-2 through personal protective equipment and improved nutrition will increase the resistance to infection. Now, there are two practical things that we can do right away. I have a paper that's going to be published in Pediatrics in the next couple of months, which looked at the impact of the Healthy Hunger Free Kids Act and the changes in the WIC package on obesity rates. Both of these programs were associated with a reduction in childhood obesity in the WIC package among kids who were 2 to 4 year olds, in the Healthy Hunger Free Kids Act among adolescents 10 to 17 years old. Now, with the COVID-19 pandemic, these programs have to change. And in Detroit, as well as elsewhere, the school meals program is delivered on a school-by-school basis. My understanding is that in many places in the country, the foods that are delivered don't require cooking and may often not require refrigeration. But it's essential that those foods conform to the same standards that we saw reduce the prevalence of obesity. And that requires monitoring, something that we've just begun to do here in DC. The other strategy is to increase WIC enrollment. We know that the WIC package decreased obesity, and increases in WIC enrollment might also decrease food insecurity, increase the likelihood that obesity will be prevented, and sustain this program for a longer period of time. So those are the most immediate policy applications. These other issues around stabilization of the food supply chain are longer term, but I think they point to the opportunity to restructure our food system, moving away from an industrialized food system and more towards a local and regional food system, which prioritize plants over meat and is a more sustainable long-term outcome. So thanks for the opportunity to talk to you today. We look forward to the rest of the day.
Thank you, Dr. Dietz. If we could move to the next slide. I'd like to introduce next is Amy Curus, who will moderate the panel on food security during the pandemic. Amy Curus is the Research and Policy Program Manager for the Detroit Food Policy Council. In this role, she acts as liaison to local, state, and federal policymakers on issues regarding food policy and leads advocacy efforts for policy initiatives such as the 10 cents a meal program. She also collaborates on initiatives to improve the land use process for urban agriculture, reduce food waste, and recognize neighborhood grocery stores. Amy represents the council at Detroit Future City, Michigan Local Food Council Network, Healthy Kids, Healthy Michigan, and the Motion Coalition to keep food policy at the table. Her goal is to craft food policy in the city of Detroit that is responsive to the citizens of the city. And she received her master's in social work from Wayne State University. Please welcome Amy.
Good morning, everyone. Thank you for being here today. I wanted to let everyone know, first of all, that Patrice Brown was unable to be here. She had a family situation crop up, but we are lucky to be joined by my fellow program manager at Detroit Food Policy Council, Kabibi Blount-Dorn, who will be talking about some of our efforts around food security. Our panelists today are, and if all my panelists could please unmute your mics, because everyone should be muted. So if you can unmute your mics for me, that'd be great. We have with us today, Kevin Frank. Kevin is the Assistant Director of Catering and Hospitality for the Detroit Public Schools Office of School Nutrition. We also have Sarah Mills, who is the, for Gleaners Community Food Bank, she is the Director of Wellness and Nutrition Education. And again, Kabibi Blount-Dorn, who is the Education and Engagement Program Manager for the Detroit Food Policy Council. And I'm proud to say that our panelists today are also both members of the Detroit Food Policy Council. Kevin serves as our treasurer, and Sarah holds the emergency food. So thank you all for being here. I'm going to have all of the panelists start with about 5-minute introduction on your organization and how you have been addressing community food security needs through the COVID-19 pandemic. I will start with Sarah, if that's okay. Sarah, you ready?
Sure. Hi, good morning, everybody. Thanks for having me. As Amy mentioned, I'm the Director of Wellness and Nutrition Education at Gleaners. Gleaners is the food bank that serves Southeast Michigan. We provide food support to 5 counties in the Southeast Michigan region through a network of over 500 partner organizations, including schools and pantries. So our work really expanded, of course, as a result of the pandemic. There were a couple different issues that we were kind of pivoting to address. One was the fact that several of our traditional food pantry partners were unable to remain open during the pandemic due to constraints on volunteers and just not being able to pivot really quickly to change their distribution models in order to continue to provide food safely in the community. And so we knew that there were gaps in food support because of that. And then also, of course, trying to address the needs of families when schools closed. So we really very quickly started working with many different partners in the communities that we serve, trying to identify where there might be increased need, where there were going to be gaps, and how we could help to provide additional support where there were pantries that weren't going to be able to be open, or where there were going to be children who maybe weren't able to access school meals. So we were able to start up about 66 emergency mobile distributions throughout the community, operating bi-monthly. So those were drive-through, no appointment needed. We tried to ensure that those were offered at times throughout the day, throughout the week, so that folks could access those quickly. And then also working with Michigan Department of Education and a lot of the local school districts to utilize some of the waivers that were put in place for unanticipated school closures, and using the summer food service program to be able to provide additional food support for families with children. And then also trying to identify how we could support our pantry partners to remain open if they could. So working with a coalition of our partners to put together a manual, a safety manual, so that we could support those pantries to either remain open or open back up with clear protocols for how to continue to provide food safely in the community.
Awesome. Thank you, Sarah. Kevin, would you like to go next and talk a little bit about what DPSCD has been doing?
Sure. So again, my name is Kevin Frank. I'm the Assistant Director in charge of Catering and Nutrition with Detroit Public Schools Community District. And we've been doing quite a bit since the pandemic started in order to address food insecurity and make sure that our students can still remain fed even when our schools are closed. Early on in the pandemic last March, when we closed down, we opened up about 20 of our schools, 25 of our schools as distribution centers so that students could come and pick up food for 5 days. When we realized that the closure would last pretty much throughout the summer, we opened up all of the schools as distribution sites because we realized that it would be a little bit difficult for some students and some parents who may not have access to transportation to get to the hub schools. So we wanted to make it as easy as possible for everybody to access the food that we were serving. So we opened up all of our schools as distribution sites, excuse me. When the new school year started this past September, we made sure that all of our schools, in addition to serving the students that were there in person, were operating as distribution sites for anybody that wants to come pick up food. During the summer, we actually had a meal delivery program for some of our medically fragile students who may be in wheelchairs, may not be able to come up to the schools for whatever reason. We were delivering food to those students. Unfortunately, that's since stopped because of budgetary issues. However, we are in contact with a couple of charitable donors to restart that program moving forward. When we recognize that the reality of the situation is some of our students only get the food that we provide when school is in session. So just because school is not in session doesn't mean we don't have the responsibility for making sure that those students are still fed. So to that end, we were doing everything that we can to make sure that our students get a meal that's not only available, but nutrient dense and features fresh foods. So a lot of the food that we distribute is actually cold. We've been distributing a lot of fresh salads, fresh sandwiches, things of that nature. We've really tried to Dr. Dietz's point, to not distribute food that has been hyper processed and things of that nature. Lately, we've honestly been getting some complaints about that because people have wanted food that they can heat up, wanted food that is microwavable or whatnot. So we've kind of made a pivot. And we kind of have a hybrid model going right now where we're distributing some fresh food, salads and fresh foods and things of that nature, and some food that can be microwaved and is easier to handle, I guess, for the students. Right now, we're in the process of really just finding that happy medium where we're providing the nutrient density and the freshness that the students need, as well as the hot food that they need during the winter and during the cold months.
Fantastic. Thank you so much. And Kabibi, can you talk a little bit about some of what particularly your scope of work at DPSC has been doing in order to address the pandemic, particularly some of the grocery store stuff, and we can talk a little bit about Food Secure Detroit as well.
Oh yeah, absolutely. So my name is Kibibi Blount-Dorn. I'm another program manager at the Detroit Food Policy Council. And one of the things that, we work more on issues that are food system wide and policy based. But one of the things that we pivoted to do at the beginning of the pandemic was we realized that grocery stores in the city, which are overwhelmingly small, independently owned grocery stores, not chains, we're having more of a challenge to pivot to provide a safe grocery environment for shoppers to better understand the protocols that they needed to put in place to adapt to and to provide PPE for their employees and customers. And so we were able to activate our network of good food advocates that work specifically with grocery store and food access programs, to work with the city and several of their departments to create a set of guidelines, sanitation guidelines and health guidelines for grocery stores that would allow them to provide safer grocery shopping environments, and also to provide additional PPE for grocery stores and shoppers in grocery stores. And also some informational materials like posters and floor signs and things like that. So that was one of the primary things that we did. We also saw one of the other challenges that we have been working to address is, as we saw sort of stopgaps along the food chain, both locally and nationally, just a challenge in coordination among different areas of the food system to help, many restaurants try to pivot to provide meals to needy families, families who were, all of a sudden in greater need because of the economic shutdown. We saw lots of, like Sarah mentioned, places that were able to provide meals were not able to provide meals. Some places that weren't providing meals before suddenly were providing meals. So just a coordination of communication among different parts of the food system to be able to make those changes was needed, and to do those things kind of efficiently. And then being able to provide information to residents of the city. A lot of people, even though lots of things were going on, it took a long time for people to understand, to find the resources they needed in that changing environment. And in addition to that, just understanding, getting information about public health information and information about changes to things like SNAP and pandemic EBT. So kind of the needs for better investment in our public health infrastructure and communications infrastructure was one of the challenges that we saw during this pandemic.
Thank you. And this is for everyone on the panel. I'll let you all decide who wants to go first, but how has the need for food assistance and increased food insecurity evolved and adapted as things have changed, as we started to see the spike in the spring and then a slowdown over the summer and early fall, and now we're starting to see the surge again? And then what kind of things are you anticipating for this winter that's coming and the second spike or surge that we're seeing right now?
I'll go. So for us, it kind of really went in ebbs and flows. In the beginning, there was a huge need, a huge participation at our and when I say huge, I don't mean the amount that we had day to day for normal meal participation, but definitely much more than we anticipated initially as far as for our distribution sites. As things kind of calmed down over the summer and people went back to work, there was, the economic stimulus packages. Our participation kind of waned, and now that we see that more, I don't want to use the word shutdown, more restrictions are coming, and people are getting back kind of into dire straits. We're seeing an uptick, and in addition to that, we're seeing kind of some logistical issues as it pertains to access not only to fresh food, but even to those hyper processed foods. So there's like kind of a lot going on as it pertains to that. One of the good things though that we're seeing is that we've been given the 10 cents a meal program, which you spoke about, Amy, and because of that, we are now able to provide fresh, locally sourced foods to our students, or I shouldn't say we're able to. We are more equipped to provide fresh, locally sourced foods to our students through the help that grant provides.
I would echo a lot of what Kevin just said in terms of kind of how things looked over the course of the last few months. Same kind of like ebbs and flows with there being a lot of need initially, and I think just a lot of uncertainty, of course. And then as other kind of supports came into play, pandemic EBT and SNAP changes, stimulus that some of the participation in the attendance at some of the mobile distributions kind of leveled off. So we are anticipating that the need will increase again, kind of the same that Kevin was just saying. We continued most of our emergency distributions, a couple we consolidated, but for the most part, we've continued all of those distributions and plan to keep those open for as long as needed, and also distributing some shelf-stable food boxes as well. We also are looking at whether we need to increase the amount of distributions again as we go into the winter months, and there are less, supports available, things that had been in place in the summer that may not be continuing. So yeah, we're just really planning to keep the level of support that we've been providing and possibly increase it if needed.
Yeah, and I think from the policy perspective, one of the things that I didn't mention before that we also shifted on was thinking about planning for emergencies and raising this in our priority level. Traditionally, excuse me 1 minute. Sorry about that. And thinking about emergency planning, traditionally when we plan for emergencies, we think about things like large natural disasters, things that are kind of short-term events in a different way than this particular emergency happened. And so as we kind of shifted to thinking about what does it look like to really be prepared for an emergency that impacts the food system, for different kinds of emergencies that impact the food system. We know that in a city, especially in a city like Detroit, where we already have higher rates in the city than in the rest of the state for food insecurity, lack of access to healthy food and lack of access to health resources, that these are emergencies like this are going to impact our communities even more than they might in other communities, than the same event in some other communities. So one of the things that we have been focusing on is being better prepared. And we also were anticipating our public health professionals that are part of our council were able to kind of like help us think through, like, this is not going to be the end of it once we got into kind of a little bit of better progress in the summer, that we would be facing the situation again in the fall and winter. So we wanted to focus on how do we shore up food security within our communities to weather the rest of this emergency. And so we wanted to, we really were focusing on what were the things that were already happening among community members to help each other maintain food security. So looking at things like farmers and farmers markets who were providing meals to their community members, who were delivering food to people who weren't able to travel to get fresh produce, who were helping to increase efforts to rescue wasted food, because there was all of a sudden this really quick shift in how in the places where food is consumed and how that food is packaged and how it can be distributed, that were causing a lot of waste, but even more waste within the system that we wanted to be able to help support reclaiming and turning around that food. So we've recently had more funding for our Food Security Detroit project, which will help organizations around the city provide additional boxes to help people get through the winter months. A lot of our farmers have been extending their season this year in anticipation of this as well. So we've seen more of our local growers, providing things like root vegetables and semi-processed products from their gardens so that they can continue to provide those additional food sources to community members. And we've been able to kind of look at the quilt of food access programs that are going on around the city and make sure that they get a little bit more funding to help them get through the winter months, which is usually the low for them, or which they don't usually have the capacity to keep extending their operations through the winter months.
All right, thank you so much. So let me ask this question, and there's a good question in the chat that I want to bring up to everyone. What policy questions that you see are being raised, and what kind of policy changes would you like to see to make dealing with some of these weaknesses that have been exposed by the pandemic more, what is a policy response that you would like to see to that?
I guess I'll go again. I think specifically as it pertains to child nutrition, we need to see, I think, universal meals across the board instead of, and this is really more for like charter schools and other areas, because with DPS being or DPSCD, excuse me, being community eligibility, our students get free meals regardless. However, there are many places around the state and even within the city, like I said, certain charter schools and things of that nature, where they're still on the old model where you're qualified by income. And the reality situation is nowadays we have people who have lost their job, or because of the fact they were qualified by income previously, those students aren't eligible for free meals, which is ridiculous, I think in this case. So the biggest policy change that I would like to see is universal school meals across the board, because it would make things much easier and much more streamlined as it pertains to procurement and distribution of the meals at any given time.
Those families were also not eligible for pandemic EBT, which was
exactly,
particularly helpful, I feel like, for a lot of families during this crisis. Sarah Krabibi, do you have anything to add?
I would add about the changes that were made to the summer food service program because of the pandemic. So there were several waivers that were put in place that made it so that you didn't have to have congregate feeding, which is typically a requirement. Parents could pick up meals on behalf of a child, which is, typically not something you're able to do with summer food service. And then also it allowed us to provide groceries instead of prepared meals. So for families that needed that flexibility, we were able to provide that. So those are things that have always been challenges with that program even before the pandemic, and really impacted children's ability to access those summer meals. And so that's something that we're advocating for and actually did some analysis of over the summer. And we'll be bringing those reports to legislators to really push for permanent changes to that program.
And I have a few answers to that. Obviously, like I mentioned before, the need for a more coordinated emergency response plan for any type of event or situation that interrupts the part of our food system is one of the things that's high on our list. But I think also in terms of I want to say that the policy changes that we saw, the policies that we saw being used during this emergency to help protect food security for some of our most vulnerable community members, I really saw as being possible because a not small but not big enough group of food advocates have been advocating some of these things for several years. And because we've already been thinking about what a food secure community looks like for us and what are the tools that would help us reach those goals, we had those tools in hand and ready to give to policymakers to say, here's this policy that we've been asking for the last 5 years that we thought that we haven't been able to get enough action behind, and it's ready for you in this emergency, and they were used. And so things like pandemic MBT, like Chef Frank mentioned, and community eligibility expansion, and the waivers for summer meal sites. And so I think one of the things that I think is really needed is continuing to build, in terms of policy, that vision of what a food secure community looks like and what are the tools that we need to be pushing decision makers to enact in order to have those things in place. So things like better policies around food access that enable grocery stores to provide more healthy food options, nutrition standards in institutions, and local purchasing ability for more of our institutions to be able to source locally, thereby building a more resilient food system within our community, so that when a disaster happens, if there's a breakdown in the wider food system, we still have resources close by that provide, that can keep our food system resilient, things like that.
Great. To that point, there's a question in the chat that I really want to get to. This is from Elizabeth Towner. She said, what are plans to better partner with the community to address food insecurity during the pandemic? For example, members of our community action councils have shared they are the ones that are taking food from distribution sites to their neighbors in need, either because those neighbors can't get out or shouldn't be out due to health risk. The community is ready to help and partner, but need to create the infrastructure for this work.
I saw that comment, and I don't have a great answer to that, because it's something that's been, was definitely an issue before the pandemic. I mean, we know that people have challenges in accessing our, at least from the emergency food system perspective, have challenges accessing those pantry locations. And so, yeah, there was a lot of kind of grassroots efforts, volunteers, folks who were picking up food on behalf of their neighbors. I think one thing that we've really been able to shine a light on and change in terms of like a challenge prior to the pandemic in the pantry system was that there wasn't a lot of accessibility, in the evenings or on weekends. Typically you need to make an appointment to go to a food pantry. You can't pick up food on behalf of someone else. And so we really tried to eliminate those kinds of barriers. And that's something that we are really going to be trying to continue, at least for this kind of, these safety net type programs, that it's just much more accessible as much as possible. But yeah, getting to folks creatively who can't get out to those distributions, that's a continuing challenge, and often takes a very local level response, and trying to see what the resources are and how to kind of plug into what's available in that community.
And I want to thank you for that comment, because I think it is really important to call out the level of community action that has really been in place for people to support their neighbors throughout this whole pandemic. I think that's really shown the strength of our Detroit community and our residents to support and care for each other. And like I mentioned earlier, with our Food Security Detroit program, that really is kind of the basis behind what the funding that we have available, we've been using to support community organizations that have been doing things like that throughout this pandemic, and hope to, so we've been providing funding as much to as many community organizations as we can with that pool of dollars. And I really think it's important to remember the important thing, I think, about those types of activities also is that those individuals and groups and organizations that neighbors have a lot of trust in and know that there's that is someplace reliable that they can go during their time of need, they're really important institutions within our communities. In addition to in addition to our gleaning organizations and our soup kitchens and our food bank, and they make it easy for people to get the help they need during times like this, when they can go someplace where they where someone that they trust and where they feel they're treated with respect. So I think, you know, it's really important to call out those efforts in light of this current situation. And I also think that, you know, we're going to continue to provide information about the efforts that we know about and share those as much as we can with community members who come to us when they need those kinds of resources, to the extent that we're able to do that. And we've been working to provide a resource list that we share with our network, to let them know what things are going on in their community, if they are in need, and also if they want to give support, what those community efforts are that need their support. And I think it's a good practice for us all to do during this time.
Absolutely. And Elizabeth had a follow-up that I can address. It just says, is there an openness to talking with the community about solutions to build on the infrastructure started? And absolutely, could be referenced that we're actually working on a community response plan to this, and that would definitely be part of that process. So we would want to hear from the people who are actually on the ground doing that work about how, ways that could be supported and infrastructure could be built on a larger level. And then finally, speaking of community support, how can the community support the efforts that your organizations are doing? What are ways that people can get involved if they would like to get involved, or support you in other ways?
Speaking specifically from our standpoint, the best way to support what we're doing is to participate. Come pick up food, and I guess in reference to the last question, we've actually seen in small pockets where community centers or faith-based organizations that are operating learning centers, or for lack of a better term, daycare centers, are showing up at some of our distribution sites and picking up 30, 40, 50 meals at a time, which is great. What we would love is to see that, just like Elizabeth said, to see that expanded, to have a partnership on the district level as opposed to that individual distribution site level, where we know that someone's going to come pick up, a couple of hundred meals per day or for distribution. So we're most definitely open to that. If someone knows someone that is willing to do that, just please give them my contact information, send them my way, and we will make things happen.
Typically, I would always encourage people to volunteer with Gleaners. We are having very limited volunteer opportunities at this time, just for safety reasons, but there are some opportunities on our website. I think the other way that folks could support our work is to just get the word out about the food distributions that are available, just so that folks know, and that communication is getting out to everyone who might need that support. And then as some of the support wanes, we've gotten a lot of federal support for the food distributions. As that is starting to go away, of course, always can use funding to make sure that we're able to continue all of the support.
Okay. We have a few more minutes here. If there's anyone, I don't see any questions in the chat, but if anyone has any questions, please post them and I will ask them to the panel. Now, we've already addressed some of these, but Kevin, this actually speaks to a question that Adele had raised about how we can create universal school meals for all students. And you had pointed out that was USDA.
Yeah, so the USDA is the governing body for the National School Lunch Program, School Breakfast Program, and the CACFP, which stands for Child and Adult Care Food Program, which is the grant program that we serve supper under. Long story short, in order for universal school meals to be a thing, we would need a policy change on the federal level. So, and like I said, there's been a lot of traction gained in that realm, especially over the last couple of months with what we see with the pandemic and the difficulty in serving specifically the National School Lunch and School Breakfast Program to everyone. CACFP and the summer meals program is a little bit less restrictive, which is why a lot of districts, us included, have transitioned to the extended summer meals program, just because it's easier and it allows us to reach more people. But the reality of the situation is it shouldn't be like that. We should be able to regardless of whether it's the summer meals program or the national school lunch program, it should be able to be served to everybody with no restrictions, everyone who needs it. And so, like I said, there's been a lot of traction gained on that front, but with the current political climate, things are a little bit difficult as it pertains to making change. So right now we're kind of in a holding pattern.
Mm-hmm. Okay. Let's see.
Amy, there is a question in the chat box from Barbara Bloom.
Okay. Yeah, Barbara asked, who are community action agencies in Detroit, Wayne County? Is it Wayne Metro? And that's a specific term. So Barbara was asking for a little more clarity on what you were referring to. And I'm afraid I do not know the answer to that question. So. All right. Let me ask this just as a follow-up question. What are some things that you are concerned about as we're heading into the winter months, a huge surge, schools are closing again, things are starting to get pretty scary out there again. So what are some things that would be helpful to your agencies as we head into what looks to be another difficult period?
I think we would always welcome if there are pockets of the community that are not being served, if there's gaps where we could provide support. We want to know that because, like I mentioned, we are looking to see if we need to expand any of the services that we had put in place. And so if there's a need and in a specific community, we would like to hear from you.
All right. One final question from Janae Moore that we have time for. Also, Dr. Dietz had asked what steps would help strengthen the role of the Dfpc. I couldn't speak to you more about that offline, but I definitely think that continued engagement with policymakers is extremely helpful because we are hearing from all these folks on the ground and are able to bring those to state and local or state and federal policymakers, which is extremely helpful. And then finally, I just want to get this question from Janae, and we only have a couple of minutes left because that's a good one. If you could change or implement one upstream, so state level policy change that impacts food insecurity, what would it be?
So I guess specifically for me, that change has already been made as far as like with 10% 10 cent a meal being rolled out statewide. I mean, that's a huge win, I think, as it pertains to policy and food insecurity for the students, not only here in Detroit, but again, statewide. Because we, as we know, we live in the most populated portion of the state. However, up until very, very recently, something that would not only help us serve very nutrient-dense, very fresh foods to our students, but also inject funds into the local economy was not available to us. And now it is. So, I mean, I'm still pretty happy about that. So it's not really something that I could change, but it's definitely something that needed to change and did. So.
Mm-hmm. I'm glad to hear that.
I'd say really quickly, SNAP is a program that addresses food insecurity much better than the emergency food system ever could. And it provides people much more, dignity and choice. And so I think anything at a policy level that increases people's ability to access SNAP, removes restrictions on folks to be able to get SNAP, those would be things that I would advocate for.
And I have a quick answer too. I was gonna say it's hard to pick just one thing because the food security is impacted by so many things in terms of health policies, institutional policies, policies around licensing of food retailers and healthy food access. And so a few months ago, I would have said re-implementation of a statewide food policy council that informs our state administrators about how our different policies in different areas are impacting the food system, which we actually saw happen recently. So we're very happy about at the Food Policy Council and among the community of food advocates here in the city. In the city. So I'll have to think of a new one now.
Okay, that's about all the time we have. I just wanted to once again thank our panelists for being here. Thank you for the work that you do. As someone who is watching this from the outside to some degree, it's just been absolutely amazing to see how quickly you've been able to do all of this and serve the community so beautifully. And once again, thank you all for participating in the panel and sharing your knowledge. Have a great day, everyone.
Good morning, everyone. It's my pleasure to introduce Sarah Hubbard, our next speaker. Sarah is principal of Acuitas, a government relations firm that represents Authority Health. Sarah is known as one of the leading legislative strategists working in Michigan government relations and has been recognized by Inside Michigan Politics. Before joining Acuitas, Sarah spent 17 years at the Detroit Regional Chamber, where she led advocacy efforts on behalf of over 20,000 firms in Southeast Michigan before local, state, and federal government stakeholders. Prior to the Chamber, Sarah spent 3 years as a legislative assistant in the Michigan House of Representatives with former State Representative Willis C. Bullard, Jr. of Highland Township. Sarah received her Bachelor of Arts degree from the University of Michigan, Master's of Public Administration from Western Michigan University, and a Master of Business Administration from the University of Michigan Ross School of Business. She formerly served on the Board of Directors of the Public Affairs Council, the American Chamber of Commerce Executives, the Woodrow Wilson Center's Canada Institute, and the University of Michigan Alumni Association. Sarah recently was elected to the University of Michigan Board of Regents. Congratulations, Sarah, and we welcome you today.
Thank you, Dennis. I really appreciate the opportunity, and thank you, Carolyn, for the stretching. While I wasn't on camera, I was up and stretching and moving around, so that was great. Yes. I look forward to serving the University of Michigan for the next 8 years as well, and was as surprised as many of you when I found out that I was actually elected to that board, but looking forward to it. So thanks again for the opportunity to provide a legislative update today. As Dennis mentioned, we do represent Authority Health and help support your needs related to Michigan government and the legislature. Typically, you'd see Andrea Cascarilla here, but she, my colleague, but she is on a well-deserved vacation this week. So I'm going to do my best to fill in her absence. So Dennis, quick question for you, actually. I know that Andrea provided a written legislative update. Would you like me to go through that, or has, first of all, or more of an update related to the kind of current status of the legislature?
Having read the report, I think there are some actionable items in there that would be helpful for the group to get, and then some insight following that, great. If you could.
Yeah, I will do that. I wasn't sure if they were given that report or not. Okay, so yeah, I'll go through that kind of issues that are very specific to the Motion Coalition, and then I'm happy to also provide kind of an outlook related to the remaining session for this year and looking forward to next year. So in particular, the fiscal year 21 budget is now in place, and as you heard from the panelists earlier, the 10 cents a meal program was in the budget and continues. So the advocacy with the governor and legislature through the paper plate campaign, formal letters of support really helped ensure that the $2 million funding was approved in the statewide preschool K-12 expansion, including in Detroit. So kudos to all of you who participated in that effort. It's a tight budget year. This year will continue to be tight next year. So getting these kinds of priorities in the budget is no small feat. Similarly, the Double Up Food Bucks program, which increases the power of residents who receive SNAP, The budget included $900,000 to continue the SNAP dollar for dollar match up to $20 a day of fresh fruit and vegetable purchases. So we'll see that again throughout fiscal year 21, which started on October 1 of this year and will go through September 30 of next year. A couple other things that may be of interest that were included in the current year in this new budget. Healthy Moms, Healthy Babies program received $23.5 million in new funding to expand Medicaid coverage for new moms and infants to 12 months from only 2 months. Add behavioral health care and expanded home visiting. Also, School Children's Healthy Exercise program received $500,000. Child and Adolescent Health Care Center Care received another $8.4 million. So some good successes there in the budget for fiscal year 21. Congrats. But looking ahead to where we're positioning things for fiscal year 22 and that process and some actions that might be needed in the lame duck session, I'll continue. So the executive budget for fiscal year 22 officially will kick off in early February when Governor Whitmer proposes her executive budget to the legislature. Then the legislature will review that and pass their version of it, have some negotiations with the governor, and hopefully not have to wait to finish it on September 29th. It would be great to try and get at least some version of that budget in place before that. But as we saw this year, the legislature wanted to give revenues as much of a time as possible to bounce back. It's not clear what that situation will be next year as far as tax payments and such at this point. They're not delayed, they are due on time, but we'll see where we're at with COVID as we proceed into 2021. So so that's what we're looking at next year, and we'll see where we're at. So additionally, COVID related food assistance, school meals, and SNAP expansion, continued as I was talking about. A couple of bills that are out there. Senator Bumstead has Senate Bill 600, which would eliminate health and physical ed from the high school graduation requirements. We may want to be prepared for a letter of opposition to distribute to the senators in case this is scheduled for a vote during the lame duck session. It's been pending in the full Senate since December of 2019. So the likelihood of it coming up is probably limited. Some of you may have seen articles in Cranes I think it was earlier this week, that the governor and the Senate Majority Leader, Mike Shirkey, are both indicating that our lame duck session may be very lame, a lame duck session, as they have said. So it would be good news for us related to that Bumstead bill if it didn't move forward at all. And just again, related to that session, it will really take place for 3 weeks, from the week after Thanksgiving, beginning December 1st until just before Christmas. So we expect that only a very limited number of bills will be taken up and passed through, probably those that are the most time sensitive or have the broadest support for them. So bills that have significant opposition will probably be very difficult to complete, which I think this Bumstead bill would have significant opposition. Additionally, in the lame duck session, we expect some kind of additional supplemental budget to be taken up. It's just traditionally at this time of year, the books for the state of Michigan close. There's typically some lapse funds that can be spent into the new fiscal year. And while I don't expect it to be huge, there could be a couple $100 million there in play for spending to be allocated for fiscal year 21. So those are things we'll want to look out for as well. And then finally, just wanted to flag for you that Senator Bullock did introduce a Senate concurrent resolution that declares racism as a public health crisis in Michigan. Senate concurrent, the resolution was assigned to a committee but not given a hearing. We may want to talk with Senator Bullock about reintroducing that in 2021, just to be sure we continue to have a strong spotlight on that issue and keep those kinds of bills and resolutions out there. Let me just pause and see if there are any questions there, and then I can continue, giving you a bit more of a political update and related to 2021. Any questions?
Sarah, we did get an email from Todd Scott regarding House Bill 4733 that changes state law to more clearly allow local control of speed limit setting. Are you familiar with that law? And because of our interest in safe and accessible exercise routes, is there anything we can do to influence it?
Yeah, let me just do a quick scan of that legislation. So, okay, so that was introduced in the House in June of last year and has not had a hearing at all. So nothing has happened with that. So I think that that bill probably falls into a similar category as Senator Bumstead's bill, that it's something that won't be moving forward in the lame duck session, but something we want to, keep an eye out for early next year and see if it gets reintroduced and gets any legs at that point. Certainly something we can keep on the radar screen, and I'll talk with Andrea about it as well. So just a little about the logistics of the legislature right now is what we are nearing is the end of a 2-year legislative session, at which point not only do a number of House members leave the House due to term limits, they won't be back, but a number of newly elected members will be coming into the House of Representatives in January and taking office. All legislation that was introduced in this session, if not passed to the governor, will die as of December 30 of this year. So that bill, the Bumstead bill, all these other, anything else that you're considering policy-wise, all those bills will die and no longer be valid in January. So for them to be considered into the future, a legislator will need to reintroduce them into the legislature and request a hearing and try and move them through the process. So that's why, some of these bills we know will just kind of go away, and the legislator who sponsored will, in some cases leaving the legislature, in other cases just reevaluate whether they want to, put any time into that issue or not.
Sarah, we have a question from Diane Valad. Are there any proactive policies around healthy living, such as food, physical activity, that might have potential for movement in 2021?
Yeah, great question, Diane. Thanks. I think what we're going to see in 2021, specifically or particularly because of COVID, is that most of these discussions will take place either in the budget process or related to the governor and any orders she may be able to, or through the Department of Health and Human Services, really any orders that they may be able to issue. I just, unless things get significantly better, I still don't see a robust policy-making environment next year. Now, that being said, I do expect the legislature to continue to meet and continue to operate and function and do business. But as far as big ideas around healthy living, I'm not personally aware. I'm afraid, Andrea may have a better handle on that. But I think, if we have ideas we want to promote with the legislature, now's a good time to be, certainly serving those up and seeing if we can find some support.
This from Dr. Ali Trippi, and I think earlier there was a question from Dr. Dietz if there are any pediatricians in the house. Certainly, Dr. Trippi is one of our pediatricians. I am sorry if I missed this, but may I ask what the benefit could be for the bill that would get rid of the gym physical education requirements for graduation? I think that's the Bumstead bill.
Yeah.
Is trying to understand the proponents. Any thoughts on that?
Yeah, I haven't talked to Senator Bumstead about it specifically, but there are a lot of bills like this that would take various requirements out of the school curriculum for a variety of different reasons. Often it's because they want more local control for schools, or because they want more flexibility for schools to be able to count, say other kinds of classes, give students, maybe students are, participating in other healthy activities that don't count related to the curriculum or something like that. But typically that's where it's driven from, is that not because they're fundamentally, in this case, opposed to exercise and healthy living, but because it's about what we do and don't tell our schools as far as what they must teach and require of students.
Well, Sarah, thank you very much. Our time is up, and we are taking notes, of course, on the opportunities that will inform our work in the coming year. So thank you.
My pleasure. Let me know if you need anything.
Thank you, Sarah. This is Diane Valad again. The morning has been really interesting, and I think we're going to have an equally interesting second discussion. We have Dr. Jim Salus. I believe he's with us, right? Should I make sure of that before I introduce him?
Yes, I am here.
Great, thank you. Coming all the way from California, so we do have a time change, so thank you. Dr. Salus is Distinguished Professor Emeritus in the New School of Public Health at University of California, San Diego, and Professorial Fellow at Australian Catholic University, Melbourne. His research interests are promoting physical activity and understanding policy and environmental influences on physical activity, nutrition, and obesity. He has authored over 700 scientific publications and is one of the world's most cited authors. Dr. Salus is past president of the Society of Behavioral Medicine and member of the National Academy of Science. So welcome, Dr. Salus.
Thank you very much. So shall we get started here? And I should be able to share my screen. I cannot share my screen.
You can just indicate by saying next, and we will proceed for you.
Got it. Okay, then it would, okay, can you put my slides up? I don't see them. So maybe I have the wrong view option. I did exit.
Jim, this is Bill. Your slides are up. We can see them.
Okay, I can see them now.
Okay.
All right, very good. Can you go back one? So this is about getting America's kids more active. And I just want you to see that this place where I'm taking the photo is the boardwalk on the beach near in my neighborhood. So just keep that picture in mind. See all the people there, including those dressed very colorfully and patriotically. Okay, next slide. So this is what I'm going to go over. A little bit about the meaning of youth physical activity during the pandemic. Just a little bit on our U.S. children and adolescents active enough, and a sampling of some of the effective strategies for increasing youth physical activity, and also how those strategies relate to childhood obesity. And because of the short time, I'm just going to say there are problems with equity in all of these topics. And we can talk about those in the discussion. So hopefully I'll leave time for discussion. Next. Okay, so here's that boardwalk again during the shelter at home orders. And you can see there's nobody there. It's closed. Even the beach is closed. So this opportunity for physical activity was taken away, at least for a while. So the pandemic has had effects on physical activity. Next slide. Oh, okay. So I thought there was going to be another panel there, but I guess not. So the issue is what I want to focus on a little bit is something that I feel has not been discussed nearly enough, and it's the benefits of physical activity during the pandemic. I wrote this paper with a colleague because I was concerned that that although there are many documented benefits of physical activity related to the pandemic, nobody was specifically encouraging activity that I could tell, that I've heard, either in adults or children. And while physical activity has been considered a essential activity, that's like allowing it, not promoting it or encouraging it. So I'm going to give you just a quick overview of 6 benefits that we identified. So next slide. The first one is that moderate activity enhances immune function and reduces inflammation. So it could reduce the severity of infections. And this is there's quite a few studies on this with adults. I'm not familiar with them for children. And the key is that the optimal benefits are from moderate intensity physical activity like walking. Second benefit is that moderate activity improves almost many or most or almost all of the common chronic conditions that increase risk for severe COVID-19. About 95% of all COVID-19 deaths are in people with chronic conditions. Of course, many of them are older adults as well, but even at younger ages, these chronic conditions put people at risk for death. And that is obviously not so much an issue for younger people. Children and adolescents. The third, moderate physical activity is one of the best stress management methods. And of course, people are under stress of many kinds worldwide. Next slide. And also, when people are under stress, it creates imbalances in the hormone cortisol that negatively affect immune function and inflammation. And physical activity is one of the best ways not only to treat or prevent the psychological symptoms of stress, but also to bring cortisol into balance, which is another way of improving immune function and inflammation. And the psychological benefits of physical activity are very well documented in children and adolescents. So this is one that is completely relevant for young people, and of course, who many of them are under lots of stress from not being able to be at school and see their friends and other things. Physical activity produces antioxidants that reduce severity of acute respiratory distress syndrome. Not sure how important that is for youth. This next one I don't think is particularly relevant for children, possibly, but I think is extremely important for older adults and those people with obesity who have both older age and obesity are associated with immunosenescence or weaker immune systems. And there's several studies showing that people who are active before and after they take vaccines for viral illnesses have much better immune responses to those vaccines. So I think this is extremely important for the whole world right now. And I keep promoting for vaccine trials to include physical activity arms, but I doubt that any are doing that. Next slide, please. Okay, so I'm just going to give one slide to give a sense of how active are adolescents in the US. One of the things we know, the most active age group is children. And we don't have good data on how active they are or in meeting guidelines, but the data we do have show that almost all or very many children in the elementary age meet guidelines. Here's accelerometer-based data, moderate vigorous physical activity for adolescents from about 10 countries around the world. And accelerometers, of course, are objective measures. You get a minute by minute or even finer detail on physical activity throughout the day. And I circled the data point for the country that has the least active adolescents, and that happens to be us, the United States. And a few others are similar, but you see several countries, European countries, are much more active than we are, and the highest number of minutes is in Norway, and about 84 minutes, and they're close to twice as active on an average day than the American kids. So we can do a lot better. Next slide. And of course, the American kids are about 45 minutes per day of physical activity. The guidelines are 60, so that's well below the 60 minutes. I want to call your attention to this report. This is called the Physical Activity Guidelines Mid-Course Report, and it's a very thorough review of strategies to increase physical activity among youth. There's only two strategies that had sufficient evidence, and that was multi-component school programs and physical education. But there were several with suggestive evidence, usually meaning that there's the evidence is still emerging, maybe not enough studies, and maybe not the strongest types of design. So active transportation, suggestive, and really very promising. Activity breaks in the classroom, sort of like the instant recess we just had. Suggestive evidence, again, very promising. Preschool and childcare settings. I am going to give you a hint from a review in early childhood settings. Built environment. I'm going to give you a little bit of information about built environment, and then some that are insufficient. So there are quite a few things that we have good to excellent evidence that work to get kids active. Next slide. So really the question now is, how well are we putting those into practice, and how can we do it more? So let's start with a connection here with early childhood programs and obesity. This one is now published, and it's a review of 43 studies on obesity prevention, diet, and physical activity interventions in early care and education. So for each of these intervention studies, we created an index of the strength of obesity prevention. And so we looked at the intensity. We coded intensity. So a low intensity would be just educational, just talking to the kids or the parents or sending information home. High intensity would be policy or environmental change, because that's available every day. And then the frequency, if you just do things once, well, that's very low. If the intervention affects kids every day, that's high. We looked at duration, and we computed these scores. So next slide. So the conclusion from this was that the intervention strength scores for diet intervention, for physical activity interventions, and for combined interventions were all correlated greater than 0.3, which is modest but important, with at least one obesity-related outcome, BMI or body fat or that sort of thing. So interventions in all of these areas were related to obesity reductions in controlled studies. And then when you added parent engagement and the strength of that, or the intensity of that parent engagement, that added to the effectiveness of each intervention category. So next slide, please. So there we have now, I think, pretty strong evidence that the things that can be done in early care and education can make a difference for obesity. This is another recommended strategy a whole of school approach. This is an Institute of Medicine report that went into a great deal of detail about what can be done at schools to help kids be more active. So I'm going to give you just next slide. I really recommend this report, and I'm going to give you one little piece of evidence that supports this whole of school approach. And what that means is that you need to do things to promote activity throughout the school day, from before school, during school, and after school. Here is one study that was done by a postdoc of mine that was published a few years ago that related school physical activity practice to activity during school. So next slide. So this is a graph of the number of activity-supported practices and how they relate to accelerometer objectively measured physical activity during the school day. And so you can see that some schools had 0 practices and others had 4 or 5 practices. And what are those practices? Having a PE teacher. So that was really probably the most important practice. And I will tell you that there are inequities in having a PE teacher. Schools in low-income districts or low-income schools are less likely to have a PE teacher. So that's a problem across the board for physical activity. Other practices, giving more than 100 minutes a week of PE, having recess supervised, providing recess. Okay, so, and what we see here is the schools that had none of these practices, their children were active in elementary school 21 minutes a day, which is for the 0. And then if they had 4 or 5 practices, it was double that, 41 minutes a day. The recommendation from the CDC is that half of the 60 daily minutes of physical activity should be obtained during school. And so, so you can see that it is possible for schools to implement practices that are effective in reaching the 30 minutes. You can do 3 of these practices and they can exceed it. And I will say that none of these schools were in a physical activity intervention study. This is natural variation across schools. And so you can see that what happens in schools really makes a difference. Next slide. Next slide. Now I want to talk about built environment and just show you one study about the built environment and with the focus on child weight status. So in this study led by Brian Salins at University of Washington, we studied children who lived in different kinds of neighborhoods, and we classified those neighborhoods by being favorable or not for physical activity. So a favorable one would be walkable. So there would be destinations close to residences. That it would have a good park. And if it was a poor or low physical activity environment, it wouldn't be walkable and would have no park. We also classified the nutrition environment, and a high or good nutrition environment would have many healthy options, grocery stores, and few fast food restaurants. A poor or low nutrition environment would have lots of fast food restaurants and no supermarket nearby. Next slide. So we were able to follow these kids over a couple of years. So really a short period of time. These are 6 to 12-year-old kids and in the Seattle area and the Baltimore area. So really very different parts of the country. And so these are 2-year results of children who were overweight or obese at baseline and then shifted to being in the healthy weight category. And you can see where was that healthy shift happening most often? Well, by far, it was in the healthy neighborhoods, good physical activity and good nutrition neighborhoods. And for those kids who were in unfavorable neighborhoods for both physical activity and nutrition, they were, a third, they were 2/3 less likely to shift to healthy weight. And these are not children who are in a program. This is just following children who are going about their daily activities. So healthy built environment was good for helping kids overcome overweight and obesity. Next slide is showing about what about those kids who started out in a normal weight category and then became overweight or obese within the 2 years. This is less clear. But what I'll point to is that if you look at the far right bar, this is the kids who were in the healthiest neighborhoods, good for physical activity, good for nutrition, and they were the least likely to become overweight or obese within this 2-year period. So this is some encouraging information that the neighborhood that you live in is important for childhood obesity, and these are things that we can change to some extent. Next slide. Okay, so there is a plan to get America active. We've had a national physical activity plan for over 10 years now, and you can see there are recommendations, evidence-informed recommendations about what many sectors of the society can do to help people be active. And many of those recommendations are for children. And the physical activity plan now is part of the new organization, Physical Activity Alliance. If you're not familiar with that, it's brand new. And I would encourage you to look up the website, paamovewithus.org.
With that, let me introduce Todd Scott, who will moderate the panel on physical activity during the pandemic. Todd Scott is the executive director of the Detroit Greenways Coalition. The coalition is leading advocacy efforts to create a citywide network of safe, convenient, and green non-motorized pathways across the city of Detroit. Todd began working with the coalition in 2008 through the Michigan Trails and Greenways Alliance. In 2012, he led the coalition into becoming a 501c3 nonprofit. During this time, Detroit has become a national leader in greenways and bike line development. Scott also helped guide the early development of the Joe Louis Greenway and secure a hike pathway on the Gordie Howe International Bridge. Prior to working in Detroit, Scott was executive director of the Michigan Mountain Biking Association. In his spare time, he enjoys exploring Detroit on bike and ultra endurance running. Wow. Please welcome Todd. Thank you.
I want to introduce all the speakers, starting with Erica Bockneck. Erica London Bockneck, PhD, LMFT, is Associate Professor of Educational Psychology at Wayne State University, the Principal Investigator of the Family Resilience Lab, and a licensed family therapist. She studies early childhood mental health in the context of parenting and family processes. Her research and clinical practice emphasize resilience promotion in populations at risk as the result of stress and trauma exposure. Dr. Bockneck currently serves as the associate editor of Infant Mental Health Journal and is on the editorial boards of the journals Infancy and Adversity and Resilience Science. Next, we'll hear from Megan Elliott. Megan Elliott is a PhD who serves as the Chief Parks Planner for the City of Detroit, which is housed within the Parks and Recreation Division of the General Services Department. In this role, she directs the 5-year parks planning process, builds strategic partnerships, secures funding to carry out the implementation of plans, and works with other departments and governmental entities on collaborative efforts in the region. She also oversees specialty parks planning initiatives, including the Joe Louis Greenway Framework Plan and the Fort Wayne Master Plan. Dr. Elliott received her doctorate in sociology and her master's in urban and regional planning from the University of Michigan. Her doctoral dissertation focused on the idea of cultural displacement and how residents, developers, and city officials variously framed redevelopment in the context of broader decline. She is interested in the meaning of public access and how we measure the impact of park space on things like public health, political agency, and collective identity. And our third panelist is Damon Porter, who is the Assistant Director of Physical Education, Health Education, and Driver's Education Department for the Detroit Public Schools Community District. He comes from a long line of educators, being a third-generation DPS administrator. Damon has a passion for physical health education, and in his current role, he has guided the department in ensuring all schools have a physical education program with a very robust curriculum. He earned his Bachelor's of Science in Education and Master's degree in Sports Administration. He is a Morris Hood Junior Pathway Scholar. He holds certifications in health, physical education, and school administrator. Damon previously worked as a teacher, interim athletic coordinator, head varsity basketball coach, basketball chairman for MMAC conference, program coordinator for Wayne State University's VAC program, and executive athletic director at the Detroit Community Charter School District. So we want to start off and hand the Zoom over to Erica. Thank you for being online this morning.
Sure, thanks so much for having me. I really learned a lot today listening to the speakers so far, and I'm most excited for a Q&A portion so I can really help tailor content to the group and be able to sort of speak about what's most useful. What I study are the effects of stress and trauma exposure on developing mental health in children and families. And I don't want to go into too much detail mechanistically. I actually think that Dr. Salus gave us a wonderful overview about the intersection of physical activity and mental health, and how physical activity can reduce stress and therefore impact mental health positively. What I'd love to talk about today in conjunction, in collaboration with Dr. Elliott, is the ways that the Detroit Parks and Rec and programming can support children and families during this extremely stressful time. A scientific and a popular concept that we're talking a lot about is the introduction of joy into children's lives and families. And in the physical health community, I think the emphasis on health often is about driving down pathology. In the mental health community, sometimes that's our goal, is to reduce mental health pathology in a linear way. However, what's often more realistic is to think about mental health on a continuum and as almost a personal characteristic. We like to reduce symptom functioning so that people's mental health is at least sub-threshold and people have the quality of life that they so choose. But we also sort of adopt a mentality that people who have experienced one depressive episode in life or who wrestle with anxiety are likely to confront and combat those mental health problems across their life. So how do we sort of live with it and achieve optimal functioning? And the introduction of joy into our arsenal of intervention strategies can be among our most powerful tools. It's possible to experience the spectrum of emotions that you feel and also hold joy in your heart. So I prescribe every day for children and families 20 minutes of intentional joy together in connection with their families and, when possible, their communities. And our parks are a wonderful place, a wonderful resource for us to experience and maximize joy together. And even during this time when we're promoting physical distancing, there are so many ways that we can promote social connection, and especially parent-child and family-based connection, to promote joy and combat the mental health risks of this period.
Great, thank you, Erica. And now if we could have Megan speak. And first of all, I want to thank Megan for being on today, because I know she got pulled into a meeting with the mayor just before this. So I'm really glad that this is working out for us today. Thanks for being here.
Me too, Todd. And I always appreciate the invitation from you. Anything you're involved in, I want to be involved in, obviously. So Todd has been a great mentor in a lot of ways. But I also I've presented once to the Motion Coalition in the past, and I really enjoyed that time with this group and with all those involved. So thanks for offering that opportunity again. I just wanted to give a little bit of context about kind of where we started at the beginning of the pandemic in terms of the City of Detroit's Parks and Recreation approach, and where that's come, how that's developed since, especially in partnership with Dr. Bockneck. So I'll talk a little bit about that, and please let me know if I'm speaking too long. And also I have a split screen, so I'm trying to look at you all. So I apologize if it looks like I'm not looking directly at the camera. Yeah, so when the pandemic hit, we were actually in the middle of a community needs assessment for recreation programming. And what we were trying to do was shift the conversation from the way that recreation was typically thought of in terms of the city's services that it provides already, as being something around really focused on athletics provision and childcare, both of which are fundamental and incredibly important, but to kind of look at this broader lens of how recreation is supportive of the whole ecosystem of kind of critical needs across the city, and how families really come to our centers as a physical space that helps support those across a broad spectrum. So we talked a lot about the social determinants of health, which is not any new terminology to anyone in this group, but certainly is for a lot of folks across the kind of spectrum of those involved in recreation programming. So we wanted to kind of create those safe spaces for families that support things from their educational needs to their banking needs, joyful connection to their neighbors and their social network. And we were actually, in the middle of having focus groups on that when we shut down our recreation centers due to COVID. So we immediately pivoted in these two fundamental ways. The first was around food distribution. We kind of, with this, we had very dramatic layoffs at the city, as many of you may be aware. We had a lot of layoffs and a lot of furloughs to only 4 hours a week for employees. So with our staff that we had, we really immediately turned to, okay, how do we get people access to food in a safe manner and in a way that gets it to as many people as possible? And I want to say that I'm representing the work of a huge team of people. So I don't, I want to give credit where credit is due, especially to Erin Casey, who's one of our assistant directors, who really led the operations side of this to make it happen. But to date, that food distribution program has served just under 1.4 million family youth meals, which is a staggering number, as well, and that's since March, as well as just over 200,000 meals directly to people's doorsteps who are COVID positive. So that second program has been, outside of our traditional kind of large-scale citywide distribution system, to actually tailor it to be able to track those food deliveries and get them to people's doorsteps who can't make it to our food distribution sites. So that's been a really significant piece of what we've been focused on with a very limited capacity. And then the second focus area has really been about safe park usage and how to navigate what we've learned at different stages of the pandemic about the disease and how it is transmitted and how people can safely use parks. So early on, the governor's executive orders often deferred to, she set a series of parameters and then deferred to local health departments and local municipalities for the recommendations at that more tailored and nuanced level. So we developed something called the Recreation Task Force, which I know is not at all a creative name. I think there were like 100,000 task forces developed in the city during those early months of COVID. But basically what the intent was there was to provide clear, consistent, and reliable guidance on what the protocols are and what the policies should be for local recreation professionals, and then also for residents in terms of how to use parks and specific amenities, what's safe, what's not. So how did we do that? The first thing we did was we created an interdisciplinary advisory panel, of which Dr. Bockneck was a critical member. So basically the kind of coalition of folks was our Parks and Rec team, the health department, which included the infectious disease, the educational arm, as well as the environmental oversight for a lot of the buildings and specific amenities and transmission questions we had. And then Dr. Bockneck providing us with this very proactive and fully integrated mental health perspective that we really needed from the onset of this to help even think about things like, how do we communicate language about how to safely use parks in a way that promotes the kind of joy and processes that she was just talking about in terms of getting families out and using the park system during this time. So that's been a really amazing experience, despite all the kind of devastation of this disease, to have that interdisciplinary group come together and help solve problems kind of across their typical barriers. In doing that, we've created reopening guidelines for indoor facilities, for our parks and outdoor amenities, and for special purpose programming. We've created a unified sign system for how to use the park safely at a time when everyone is kind of overwhelmed by decision fatigue. We've created a platform for conversation where they can ask us directly for assistance on specific questions they have, or ask the group more broadly. So we have those kind of regular meetings with a much larger group of providers that I had a lot of positive feedback on, especially in the very beginning, where people felt like completely overwhelmed by looking at national standards and not knowing how they applied locally. And then we've revamped our permitting process to include health department sign-off and mental health consultation, if folks were interested in that, to kind of flexibly accommodate those changes that have been happening with the executive orders. And then finally, we focused on these series of educational campaigns that help people find their closest park. I know we talked in the last presentation about physical activity environments, and we've been working really hard in our park system over the last several years to close the gap in park access citywide so that every resident has a park within a 10-minute walk. So the most recent number we've gotten on that is 80% of residents have access within 10 minutes of a walk from their house to a park. So explaining to folks where those parks are, what are the safe routes to get there, and what is available to them in those parks in terms of amenities. And as we head into the winter months, we're really focused on this message of taking a break, taking a recess from your Zooms, which I probably don't follow. But figuring out ways to make those safe social connections in parks if you're feeling isolated, in the ways that the park system is more critical than ever, and that can serve everyone. So that's the kind of whirlwind, super lightning speed version. I don't want to go over my time up front, and I'm more excited, like Erica said, about the Q&A. So I'll pass it back to you, Todd.
Great, thanks so much, Megan. And now if we could have Damon, if you could begin, we'll queue up your presentation.
So thank you. I'm very fortunate for you all to invite me. I'm going to share with everyone what DPSCD has been doing with COVID-19. I first want to start off with a quote from John Wooden. Things turn out best for the people who make the best of the way that things turn out. I believe this quote embodies our school's district's response with our staff, students, parents, administrators, and also our leadership of how we responded to the COVID-19 pandemic. Next slide, please. So how do we promote physical activity? We are blessed enough we're blessed to have a superintendent at DPSCD that actually cares and actually values physical education and physical activity. It was good to hear Dr. Salus presentation because it lets me know that we are on the right track. Dr. Vitti, a couple of his district-wide mandated priorities and initiatives are geared towards physical education and physical activity, such as having, first thing that he did when he came to DPSCD is having, one of his initiatives is having a PE teacher at every school, PE at every school. Another initiative was creating a robust health and phys ed pacing chart. And then along with that, he mandated the last priority geared towards physical activity and physical education. He mandated mandatory 150 minutes of physical education a week per school, per student. And this comes in to play with physical education and recess. And our master schedule is a requirement for recess. Teachers cannot hold, they like to do that a lot in elementary around the country. They cannot hold students back or stop students from having recess. I believe that Dr. Vitti did a good job of investing in physical activity and physical education. Also, I would like to talk about how we encourage athletics and encourage athletics in participation. During the pandemic, one of the things that got shut down was athletics. And in transitioning back to athletics in the summer, many schools opt out of some, if not all, of athletics with MHSA. We did a good job of our department, our athletic department, which is separate from us, participating in this many challenges they have in athletics, practices, the guidelines, the recommendations, spectators that they have to endure, but they persevered and they did not give up and because they saw a need and the value of participation in athletics. One thing that we lean on a lot are our partnerships, and we value a lot our partnerships. One of the partnerships I want to discuss real quick is building healthy communities, Step Up for School Wellness through Blue Cross Blue Shields. In the summer, I was able to connect with Step Up for School Wellness because I saw a need for a district-based resource for all our schools. Step Up for School Wellness is geared towards building healthy school culture within each school. They were able to find funding for 104 schools for us for grants, and they have 13 resources geared towards physical activity and also nutrition and mental health support for not only students, but staff and administration. Next slide, please. As you know, we had many challenges because it was an abrupt closing in March, which nobody was really prepared for. But it was a learning, an opportunity to learn. One of the biggest challenges for our staff was, especially physical educators, was transitioning from online, from face-to-face to online. And you're asking someone an instructor who is a face-to-face, hands-on, this is a hands-on class or curriculum to go online. So that was a big challenge, but we supported our instructors by giving them professional developments, and that's ongoing professional developments on not just how to instruct online, but also using the platforms such as Teams and Schoology. Another thing that we were able to do for kids were create virtual lessons. These initially in March, because it was so unplanned, we created these in packets because we knew that our students, a lot of our students, or most of our students didn't have the technology. In the summer, what we were able to do, we were able to prepare for the fall, we were able to partner up with Connect the Futures to pass out laptops to prepare for the fall sessions. In that, we also knew that we were going back to work. Parents were concerned with where their students were going to be if they did go back to work. So we had several options that for parents, which a lot of school districts didn't, such as face-to-face, online, and a hybrid model, which we call our learning centers, where students can come into the computer lab and learn and be online with their teacher. We also had options for staff because that was a concern and we wanted to meet their needs if they didn't want to come face-to-face. As Dr. Salus mentioned and pointed out, there are a lot of mental challenges, mental health challenges. So we partnered up with Trails and, like I said before, Step Up for School Wellness to support some of those mental health challenges that staff and students may have. Next slide, please. Now, there still are challenges that are out of our control, such as online instruction. We're limited to space. We can't control what's going on or the safety of the students area. Limited instruction. We can only cover certain instruction or certain curriculum, that being without equipment, which we, our goal and our vision and dream is for all our students to have equipment. And that's what we're trying to figure out, how we can get funding and manage that for students that have equipment at home, every student, just like we had with laptops. So that's my time. Again, thanks for having me. I'm going to give it over back to Mr. Scott.
Thank you so much, Damon. That was awesome. And so first question we'll kick off, and perhaps this is for all of you. But the city, the county, state has all been encouraging people to get outside during COVID and use the parks and trails. But with the coming months, I mean, some people might not find joy, if I could use that word, in doing that because they're not used to being outside in the winter, perhaps. Have you seen any interesting messaging or approaches to encourage people to get out and still get that exercise outdoors?
So I can speak first to what the city is trying to do. For a long time, we've been wanting to be more of a winter city because obviously a good half of the year is really cold in Detroit. And we'd like to encourage more physical activity throughout those months outside, especially. So this is really kind of helpful to our broader goals, even outside of the pandemic. But the part of the problem we've had, and I think I referenced this in what I was saying, is just the sheer, kind of capacity of us not being able to have the staff to actually deploy in the ways that we would like to do, kind of COVID safe programming already takes additional staff, but we've had really significant staff cuts to our programming side. So what we've focused more on is the kind of educational campaigns and media campaigns. We've taken over some billboards across the city, reminding people to just step outside. We're working on developing a coat drive so that folks can have the equipment and gear necessary to feel comfortable being outside. So we'd like to do a lot more of that. And we're coordinating some kind of bonfire type of events throughout the winter months in our parks where folks can kind of come up and participate on a one-on-one or in their pod or family basis. So they're not like organized activities in the same way, but they're more kind of passive opportunities to participate. And I would be the first to say that that's not ideal in terms of getting folks out in a proactive way, but it's kind of where we are right now and the best that we can do.
If you don't mind if I jump in a little bit here too, you really hit the nail on the head when I think you said in so many words that people just don't know kind of how to do this, how to experience joy in the outdoors in the winter months. It is in part about a paradigm shift, a perspective shift. And Dr. Elliott and I are developing a lot of partnerships both around the city and nationally, and we're hoping in the coming months to bring more resources to the residents of Detroit so we can really teach people how to be outside, physically distant, together, experiencing joy, how parents and children can get outside more. And so we will have more concrete resources coming on this. But what I want to say for today, for those of you who work directly with families, we have to really challenge the assumption that parents hold that there's only a couple of narrow ways to experience joy outdoors together. Just as a really quick example, Michiganders are all really good at the fall, right? We take our kids outside, we notice the changing colors in the leaves, we take fall walks. We have a lot of I'm sure everybody's already thinking of ideas about ways that you get outside and enjoy the fall and experience joy. You can do that in the winter. There are really similar parallel activities parents and children can do together in the winter months that are about experiencing joy, walking, singing, dancing, playing hopscotch, skipping down the street, noticing how the trees have again changed, what that means, doing some education with even younger kids, some science education around the changes, identifying the cumulus clouds and the other kinds of clouds in the sky. Actually, all of this can happen in the winter is my point. And we really have to tell people that not only are there lots of ways to be outside and looking in each other's eyes and faces and smiling, but this is really critical for health, actually. And so it isn't just something that you can do, it's something that you must do.
I like to say one of the things that we planned right before COVID and DPSCD and Dr. Vitti signed off on, and we had buses geared. I'm about exposure. One of the things we planned, believe it or not, we partnered up with Metro Parks, and we were going to have field trips, PE field trips embedded. Well, it's embedded in the curriculum, but we were about to start executing our field trips, and one of the field trips were at Metro Parks is winter sports. And we wanted to expose the students to something other than the inner city and more rural experience. And another partner that we have is the Red Wings. And one of the things that we participated in last year, the Red Wings were a big partner, and they do a lot for our district, but they handed out ice skating vouchers for Campus Marsh. So we plan on participating in that again. We also promote recess, and it is built in the online virtual schedule right now. And that's something where we promote for them to go outside and stretch and walk around during the school day. I can't hear.
Sorry. Dr. Salus pointed out in his earlier presentation that Norwegian children got twice as much physical activity as American children, and I don't think their weather is any better than ours. So, so we can do this. We had a question come up on the chat box asking, is the perception of safety a barrier to park use in Detroit?
I think perception of safety was initially a barrier to park use in the city because no one had the general public and myself included, it was not used to kind of constantly making decisions on the basis of what surfaces you could touch, who you could be around at what distance. I think the more and more we learned about this, those perceptions did change. And what we've really been trying to push is that it is 20 times safer to be outdoors than indoors right now. If you're, going to be doing some sort of activity. And we have found, we've done a bunch of focus groups recently where we found that folks still don't kind of recognize that. They think first and foremost that their own home is the safest environment. And since there's, you know, the walls that control that home space, I think families are still really hesitant to get out and use parks. But I also think that the kind of safety perception relates to this kind of concept of decision fatigue that Dr. Bockneck and I worked a lot to try and figure out how to assist with throughout the summer, which was, you know, you are going to be faced with so many variables every day and with every decision you make related to COVID and your daily life. How can we assist in helping you understand what are the levers of those decisions and how they kind of measure up against your own priorities and your own mental health? So getting outside and being in a park is kind of like a lot of decisions folks made about eating at restaurants this summer. You know, we know eating at an outdoor restaurant would obviously be a lot safer than being indoors. So if you're in a park, what are the types of amenities that you can use, and what are the ways that you can use them at different times of day that are a lot safer than other times? So we've basically just tried to kind of create a system that's more about information sharing that helps people be empowered to make those decisions about risk. And I think that has shifted the kind of perceptions of safety.
If I might just jump in here too, I see on the chat that somebody asked about the darkness, and I think this dovetails nicely with what Dr. Elliott has shared about how to sort of think about safety in the parks. It is true that work schedules are what they are, school schedules are what they are. I just want to reiterate that what we're really recommending is intentional and somewhat, I don't want to say minimal because everything now is hard. Everything's a challenge, but don't think of it as an entire afternoon at the park. And don't think of it as like it has to be at the end of the day, because that's normally when I think about physical activity occurring. If your children are virtual learning at home, take 20 minutes during the lunch break to get outside, jump rope, play basketball, play catch, have a quick dance party in the living room. I really think that we need to scaffold for the folks that we work with around these ideas and come up with really good solutions in the time that we're living in. Yes, what we're losing out on is so much during COVID. One thing that we can reframe as a positive, though, is that in some ways, we have even more autonomy over our time. In some ways, we don't. And our ability to connect with each other and engage. I'm a parent of 3 kids. And sometimes when people say that to me, like you get all this time with your kids, I'm like, oh God, but like 10 hours of it is spent making them do things and cleaning and cooking and the laundry. And we have like 9 times the dishes and they have to sit at the computer and the virtual, that's what comes to mind. And then I think to myself, but I have 20 minutes, right? I have 20 minutes every day that I can be with them and move my body and experience joy and physical activity together. That is there and I can find it.
I know we are supposed to have a call to action and we might have to make that briefer than what we wanted to. Let me start just by thanking everybody who participated today, the presenters, the panel moderators, the panelists. Everybody is so busy trying to handle COVID and taking your time out for a 2.5-hour virtual meeting was just terrific. I think the discussion today was terrific. I think it actually, in terms of a call for action, really to me sets the table for the coalition coming together and developing priority policies for 2021. There's no shortage of policy issues that need to be worked on at every level, federal, state, local government. What I heard was obviously that there is great evidence-based research out there that could help drive our solutions. And we need to work to figure out in our current political climate, which ones we can make work and which ones might be feasible to actually work on as a coalition. So I think what I would like to say, and I'll give Tiana a chance here, is that I think our call to action is really to invite you all and others you know who are working on these initiatives to join the coalition. Let's work together and collaboratively. I think our voice is louder when we work together. There's just the myriad of issues we've heard today. I think we can promise as the coalition to provide a summary of today's discussion. We've got copious notes, which is why I think trying to parse out key calls to action, I'm going to just overlay that and say, we need you at the table working with us, working together to figure out solutions, especially during this pandemic. I think just understanding the work that has been done is terrific, both on the physical activity side, on the healthy nutrition side. Clearly, people have stepped up and met the challenge, but this thing isn't going away. We're in the middle of a surge right now. We are entering cold weather, as we've heard. We need to keep being creative. We need to keep talking to our local, state, and federal governments to get funding assistance with this and really, really drive our work. So before I turn it over to Carolyn to close, I do want to ask Tiana if she has any particular issues she wants to raise in this call to action.
Thanks, Diane. I think that you beautifully captured kind of the essence of what we've discussed today. There were, I mean, too many amazing ideas to share, and I think there are two kind of parting words that I'd like for all of us to consider as we go through and really think about our call to action and what policy areas, what policy levers we want to be pushing and pulling next. So the first thing that I want us to all reflect on, I was struck by Kabibi's words early on when she shared with us this idea of us needing to continue to build the vision of what a food secure community looks like. And that can be taken in so many different ways. And I think if we use that as the underpinning, a foundation, if you will, on how we want to move forward in the food space, it just helps us kind of frame what we're looking at as a goal going forward. And Diane mentioned several things. We talked about several things today. It's universal school meals, it's expansion of funding for programs that are essential for food access and healthy food access. And then a coordinated emergency response plan, which is, critical for right now, what we're living with right now. And so I think when we look at policies as well, it's a two-pronged approach. There's the immediate need because of the pandemic that we're currently living in. And then there's the longer term, more robust, beyond the pandemic food security issues that we need to be tackling. So I look forward to thinking through that going forward with all of you. In terms of the physical activity space, Dr. Elliott posed a question, how is recreation supportive of the ecosystem of health and well-being to families in the community? And that again is kind of a guiding star, if you will, in how we should be thinking through what policy levers to be pushing. We heard really wonderful things that are going on, and how are we making sure that we're still promoting physical activity and movement in the time of the pandemic. One thing that I thought was really important that was brought up was securing funding for equipment for PE and homes to students. That's one immediate thing that we should probably be looking at. But beyond that, funding for city parks, how are we making sure that they're not only well lit, but they're meeting the needs for our community members in ways that allow them to also access and utilize the parks just as anybody else. So, I think that there's so many ideas that we could be taking this, and I encourage folks to kind of think of that two-pronged approach for the immediate need in the time of COVID, and then kind of more robustly going forward. But like to thank everybody for your participation today and a wonderful discussion. I wish we had 3 more hours together. So thanks, Diane.
Thanks, Tiana. Tough to wrap this up in a couple minutes, but again, want to thank everybody again who joined, and I also want to thank the Authority Health team who really put this whole thing together. First time with a virtual event, I think it worked. I want to thank the planning committee, also spent a lot of months really putting this together and thinking through during a pandemic what information that might be helpful. But again, I encourage you, if you're not a member, please join. And we will get out a summary of this, try to strategize key opportunities. I think Tiana provided a great quick overview of where that might lead. And I guess with that, I'll turn it back over to Carolyn.
All right, so it's the end of the road for us today. Thank you so much, everyone, for attending our mini summit. There's lots of great, valuable information shared. And we want to thank you. We want to thank our sponsors, Blue Cross Complete and Health Alliance Plan, for helping to support the Motion Coalition and make this a reality. A link to the recording for this video will be distributed to everyone, as well as summary notes and the other documents that were supplementary. So thank you again, everyone. Have a great day, and I thank you so much for coming.